We first met Asma and the team at around 10 weeks gestation, and it was then that we learned about our triplet setup, and 2 of our babies shared a placenta, and we had a singleton with her own placenta, and that presented a risk of twin-to-twin transfusion syndrome. Fortunately, it never presented itself beyond the early stages, but the way they managed that risk in offering us weekly scans, first we started out with fortnightly scans to begin with, and then moved to weekly as things looked a little bit more concerning. And we really just felt that with their close eye on the pregnancy, that really they would be able to intervene at any stage if necessary.
Their level of expertise meant there wasn't any panic. When the symptoms first started showing themselves, they were saying, you know what, babies can correct this, we just need to monitor you more, we don't need to take any more drastic action at time. It was so reassuring to know that they had the facilities to undertake any kind of procedure to correct that. And Asma even said, you know, we like using the laser, but we don't need to use it now. If we do, then absolutely we'll use it. But for now, we're going to keep monitoring you. And the babies corrected it themselves. And the fact that there wasn't intervention there, and the fact that the bench was so deep with the consultants. So when we didn't see Asma, we saw Amar or Baski or one of the others. It was incredibly comforting to know that you were at a hospital that had that expertise and they were really in your corner.
The level of care provided by the multiple specialist midwife was unbelievable. So in particular, I'm thinking about a time when I went in quite obviously suffering from some aches and pains. And I think a lot of healthcare specialists would say it's par for the course with a triplet pregnancy. But Sarah actually said, you know what, let's deal with this. Let's refer you to physiotherapy. So I had some sessions downstairs, and the physiotherapist there referred me to hydrotherapy, which was amazing. It was a class once a week specifically just for expectant mothers. So we were all hugely pregnant women in a pool once a week doing exercises together. And it was the one time every week where I felt totally weightless. And it really, I looked forward to it so much because I would walk into the pool and just the weight of the triplets would leave me. And I'm 100% sure that that's why I recovered so quickly after my C-section, because I was able to keep my body strong through doing that. Towards the end of my pregnancy, we got a call from the hospital, and the lady on the phone said that Asma had been reviewing my file. This was a Sunday night. And she'd looked at some symptoms that I'd had, liver failure, low platelets, anemia, and thought that I needed to come in. It turned out that I was diagnosed with HELLP syndrome, and I didn't end up leaving the hospital after that point. My babies were delivered 3 days later via emergency cesarean. That level of care, that attention to detail, to pick up my file on a Sunday night while you're just doing the rounds, incredible.
And even the fact that we were always scanned by doctors, and the relationship you build up with those as you see them week to week, and the fact that the research and clinical fellows made the effort to come into the operation even though their shifts had finished. And it had been a long and complicated day with lots of twists and turns, and the midwife that had been looking after Shelley all day, she should have gone home, but she insisted on being there for the cesarean because an obstetrics theatre is it's an intimidating environment especially for if you're delivering triplets, because you have 2 neonatal nurses and a consultant neonatologist per baby. So having familiar faces in there really made the difference. I think that kind of sums up George's for me.
Absolutely. So we have 3 girls, Emily, Sophie, and Molly. Molly is the oldest and the singleton, so she's not identical to the other 2. And she has her own little personality.
Molly's in her own little world.
She is kind of in her own little world. She often needs some own time, so we put her on her own in the cot upstairs, let her just chill out a little bit. Emily's the youngest and the feistiest. Even on the neonatal unit, she was referred to as Princess Emily. And Sophie is our middle child. She's Emily's identical twin. And she's perhaps our most I don't know, jolly baby, and just is quite smiley all the time. She's our milk monster.
She is.
She's
an absolute milk
she's
monster.
quite pudgy now.